this video, we are going to discuss a few differences between intestinal tuberculosis and Crohn's disease and how to differentiate these two. We can see that we have a small intestinal biopsy over here, right? There are certain villi over here, and you can see that there is a ulceration, mucosal erosion over here. On zooming in, we can see that there is a small ill-defined granuloma. It's not necrotizing, right? And you can see there are a few crypts over here which are, there is crypt branching over here, crypt branching again. So these crypts are definitely branched. So this is crypt branching is an important change of chronicity. And we do have lots of plasma cells over here. And apart from plasma cells, we can also see a few eosinophils here and there. So we have changes of chronicity, and we have few ill-formed granulomas over here, and what we see are a few ill-formed granulomas over here also. And it's important to note that these granulomas are in between the crypts. So these type of granulomas are crypt-centric granulomas, which are usually present in between the crypts. And as I said, again, we can see a few eosinophils over here. We can see lots of plasma cells and crypt branching as well as crypt distortion. We see again an ill-formed granuloma over here, right? So this is a change of Crohn's disease. This is a case of Crohn's disease which we have here, where we have features of chronicity, right? Like crypt distortion and crypt branching. There's enormous crypt branching, and then we have ill-defined or ill-formed granulomas which are probably crypt-centric, and these granulomas are very small granulomas, often referred to as microgranulomas. So these are some features of, again, we found ill-formed granuloma over here, a small granuloma over here. So these are features of Crohn's disease. Now we're going to look at another case. Okay, again, we can see that this is a small intestinal biopsy. We can see a few villi over here. However, there is certain amount of destruction of the villi. There's mucosal ulceration, right? And we can see a few necrotic areas. When we search further, what we can see is these large granulomas. Okay, these large granulomas are extremely large compared to the ones we saw before, which were small microgranulomas. And there's definitely a central geographic caseating necrosis with epithelioid palisading histiocytes. So this is a caseating granuloma. And adjacent to that, what we see is another granuloma with another central caseating necrosis with palisaded histiocytes. Now, this is what is known as a confluent granuloma. We see a giant cell also over here. Confluent granulomas are two granulomas which are attached together. So this is a confluent granuloma. And also one more thing to note is, we can clearly see that these granulomas are not mucosal, and these granulomas are present in the submucosal region of the small intestine. So these are a few differentiating features of the granulomas which we see in Crohn's disease versus the granuloma which we see in intestinal tuberculosis. So the previous one was Crohn's and this one is intestinal tuberculosis. Thank you.